What are the symptoms and signs of implantation bleeding?
Hello, and welcome to our informative session today. We're going to discuss an important topic related to early pregnancy, which is implantation bleeding. Many women might experience this phenomenon but may not be fully aware of what it means. Let's get started.
What is implantation bleeding?
Implantation bleeding is a small amount of bleeding that can occur in a woman's reproductive system when the fertilized egg, or embryo, attaches itself to the wall of the uterus. This typically happens about a week or so after ovulation, but before your expected period.
What are the symptoms of implantation bleeding?
When it comes to spotting implantation bleeding, it's essential to note that its signs can vary from person to person. Here are a few symptoms you might notice. 1. Light spotting. Unlike your regular period, implantation bleeding is usually very light and might only result in a few drops of blood. It's so light, in fact, that it's often missed or mistaken for a light period. 2. Color. The color of implantation bleeding can range from light pink to brown. It's not usually bright red, which is the color of fresh blood. 3. Cramping. Some women may experience mild cramping around the time of implantation. These cramps are typically lighter and less severe than the cramps experienced during a regular menstrual period. 4. Timing. Implantation bleeding often happens about a week or two before your expected period, coinciding roughly with the time of your cycle when the fertilized egg would implant in the uterus. Remember, not all women will experience these symptoms, and some may experience none at all.
What are the differences between implantation bleeding and a period?
Recognizing the difference between implantation bleeding and a regular menstrual period can be challenging. Here are some key differences. Duration. Implantation bleeding usually lasts from a few hours to a few days, whereas a regular period tends to last between 4 to 7 days. Flow. The flow of implantation bleeding is typically very light and might not even require a pad or tampon. On the other hand, menstrual bleeding usually starts light, becomes heavy, and then lightens again. Color. As mentioned, implantation bleeding tends to be light pink to brown, while menstrual blood is typically bright to dark red. Associated symptoms. Implantation bleeding might come with mild cramping, while menstrual periods can often come with more severe cramps, bloating, mood swings, and other premenstrual symptoms. We hope that this video has been useful in helping you understand the symptoms and signs of implantation bleeding. Remember, if you're ever uncertain or worried about any unusual bleeding or symptoms, it's always best to consult with a healthcare professional. Until next time, stay healthy and informed.